Speaker, I rise today in strong support of H.R. 372, the Competitive Health Insurance Reform 17, which would take a big step towards creating a more business and consumer-friendly insurance market that works for all Americans. As I listened to the comments just before I stood up, I heard this is a fine bill. It's more than a fine bill. This is a good bill. And let me tell you how I know it's a good bill. Because a few years ago, both Nancy Pelosi and Mike Pence voted for it. Now, what the Democrats don't want to tell you is that on February 24th of 2010, less than a month before the Affordable Care Act was signed into law, there was an agreement that allowing the insurance companies to be exempt from the antitrust laws of the country was a problem. So how is it that with a bill that passed, 406 yes votes to 19 votes, that when it came out of the dark rooms, the Affordable Care Act was brought to the floor with the comments of, well, you'll have to read it to find out what's in it. Perhaps the Democrats should have read it to find out what wasn't in it, because the leadership not only sold America out, they sold them out. This bill passed 406 to 19, and yet in the back rooms where they put the Affordable Care Act together, they didn't include the provision. While the Affordable Care Act certainly has played a major role in the disruption patients and providers have experienced, the decades-old special exemption, which they voted to take away, and then the leadership of the Democratic Party gave it back to the insurance industry, from federal antitrust laws has eroded confidence and competition in the marketplace. Fortunately, we have a vehicle before us to walk back this special deal. The legislation currently before the House would inject much-needed competition into the health insurance market by eliminating the antitrust exemptions for health and dental insurers, leveling the playing field, and giving consumers and providers more leverage and better options. There are very few antitrust exemptions in our country, and for good reason. This exemption is not only damaging to the consumer when they purchase health insurance, it damages the health care providers, further limiting consumers' access to services. The dominance of the market that large insurers have enjoyed has forced many providers to move, close, merge, or sell to larger regional hospitals, impacting parties across the industry. In the 24 counties of Georgia that I represent, patients have few health care choices left. That impacts their ability to receive quality care and negotiate for a policy that meets their unique needs. Echoing that sentiment, I think anyone who has skin in the game will tell you that a majority of the problems in the health care marketplace trace their roots back to a lack of competition. Yet the Democrats left the insurance industry exempt from the antitrust laws once again when they passed the Affordable Care Act. While insurance companies have the power to negotiate, just as they proved in the negotiations with the Democrats on the Affordable Care Act, pharmacies, physicians, and hospitals are left without a seat at the table. When the insurance companies get to determine who is and isn't able to provide health care services, the insurer-provider relationship is closer to extortion than negotiation. So why do we allow the health insurance industry, who controls through their contracts who your doctor is, who your pharmacist is, which medicine you can get, and which hospital you can go to, be exempt from the antitrust laws of the country? How could the Democrats do that to you in the Affordable Care Act? By definition, health care and health insurance are not the same thing. But when one industry, one insurance company controls such significant portions of the cash flow of all of the providers in a region, no provider can stay in business without a contract with that carrier. Therefore, the insurance company gets to determine who is and who is not able to provide health care. Removing this antitrust exemption for health insurers means one more option for consumers: increased competition between providers and greater certainty for insurers when it comes to hammering out and working for consumers across the spectrum. Should have been done long ago, but the Democrats turned their back on the American public and again granted the health insurance industry an exemption from the antitrust laws of the country. Now, while this is certainly not an end-all be-all to reforming our broken and dysfunctional health care system, it's a common-sense step towards untangling the mess our health insurance marketplace has become. I also think it noteworthy to mention, again, February 24th, 2010, the Health Insurance Industry Fair Competition Act passed the House with a vote 406 to 19, only 1 month prior to the Affordable Care Act being signed into law. And yet the American citizens once again were sold out by the Democratic Party. I strongly believe this piece of legislation currently before the House lays a firm foundation in our work to fulfill our promise to fix our badly broken health care system. Today we have the opportunity to provide relief to consumers and providers alike. And I urge my colleagues to vote in favor of H.R. 372, the Competitive Health Insurance Reform Act of 2017. Mr. Speaker, I yield back the remainder of my